According to the American Cancer Society, colon cancer is one of the deadliest cancers in the United States. But fortunately, if you find it early, it can often lead to a complete cure. We're going to talk about treatment here with Dr. Andrew Ross of Boca Raton Regional Hospital. Thank you very much for joining us, Doctor. And let's first of all, let's define colorectal cancer, and if you could do that, please.
Well, colorectal cancer is obviously a malignancy of the colon and the rectum. It's often an insidious disease whose symptoms are sometimes difficult to identify early on, and that's why we recommend early examination of patients who are developing symptoms, as well as screening early.
Okay, so I'm someone who walks in, I get the diagnosis. What is next? What's next for the treatment options of colorectal cancer?
Well, the first thing to understand is that colorectal cancer is very treatable and curable in its earliest stages. So what we typically do once a diagnosis is made is do some examinations to ensure that there's no evidence of disease elsewhere. And the mainstay of that is usually CT scanning of the abdomen and the pelvis.
Okay. And the severity of the cancer can help determine what type of treatment is best?
That's correct. The mainstay of treatment is surgery. And after the surgical procedure, the tumor is what is staged. We determine at that point, based upon the pathological evaluation of the cancer, what, if anything, is the next step in terms of treatment.
Perhaps there's someone out there that cancer is not in their family history, and they have this diagnosis. Why is it important, rather, to detect it early so it doesn't spread? Can you kind of explain that? Because it will spread and develop into other parts of the body, correct?
That's correct. The earlier the tumor is actually diagnosed, the less chance it is the tumor has of spreading into what's called the lymphatic system, which is tissue around the colon and the rectum, through which this can lead then to dissemination of the cancer into the bloodstream. So when we find it early, when the lymph nodes in the specimen are not involved, this is often a cure, and that's the key to curing colorectal cancer.
Speaking of treatment, when is surgery an option?
Surgery is the mainstay of treatment. Tumors that are early can be cured surgically. There are numerous surgical type procedures depending on the location of the tumor, but surgery is quite often the first step in treatment.
And rather quickly, early diagnosis, get tested, get screened. That's the message here.
There's no question.
Sure. All right. Thank you very much, Dr. Ross, for joining us. And Boca Raton Regional Hospital sponsors our expert and underwrites our Ask the Doctor segment.
At home, at work, or on the go. If you've got a medical question, log on to the new WPTV.com. Click Marketplace, then ask the doctor. It's easy to use and just a click away. WPTV.com.
Ask the Doctor is sponsored by Boca Raton Regional Hospital, which provides the physician for this segment.